Pneumonia is one of the most high-yield topics on the NCLEX, and if you're not fully confident about it yet, this video is going to change that. We have 20 NCLEX-style pneumonia questions with full rationales, and we are going through every single one of them together today. By the time this video is done, pneumonia is going to go from one of your weakest topics to one of your strongest. Keep track of your score as we go, and when we're done, drop it in the comments. I want to see how everyone did. So if you're serious about passing, grab your note and pen, get comfortable, and let's begin. A nurse is admitting a 68-year-old male with fever, productive cough, and shortness of breath. The physician documents the diagnosis as pneumonia. The nurse understands that pneumonia is best defined as A. An infection causing inflammation of the lung parenchyma, B. Chronic inflammation of the upper airways, C. A viral infection affecting only the bronchial tubes, or D. Accumulation of fluid in the pleural space. The correct answer is A. An infection causing inflammation of the lung parenchyma. Pneumonia is an infection that causes inflammation of the lung parenchyma, which refers to the functional tissue of the lungs, including the alveoli, or air sacs. This inflammation leads to fluid and exudate buildup, impairing gas exchange and explaining this patient's fever, productive cough, and shortness of breath. A nurse educator is teaching student nurses about pneumonia epidemiology. Which age group does the nurse correctly identify as being at the highest risk for pneumonia-related mortality? A. Adults aged 46 to 60, B. Children under 5 and adults over 65, C. Adolescents aged 13 to 17, or D. Adults aged 30 to 45. The correct answer is B. Children under 5 and adults over 65. Children under 5 have immune systems that are still developing, while adults over 65 experience immunosenescence, which is the natural decline of immune function with aging. Both groups also have limited respiratory reserves, making it harder for their bodies to compensate when lung function is compromised by pneumonia. A new graduate nurse asks a preceptor, "Why do we screen all admitted elderly patients for pneumonia risk?" The best response by the preceptor is A. Screening is only required for patients admitted to the ICU. B. Early identification of at-risk patients allows for timely preventative interventions and better outcomes. C. It is a hospital policy with no strong evidence behind it. D. Elderly patients always develop pneumonia during hospitalization, regardless of precautions. The correct answer is B. Early identification of at-risk patients allows for timely preventative interventions and better outcomes. Elderly patients are highly vulnerable to pneumonia due to weakened immunity, reduced respiratory reserves, and exposure to hospital pathogens. Early screening allows the healthcare team to promptly implement preventative measures such as proper positioning, deep breathing exercises, vaccination, and oral hygiene, all of which significantly reduce the risk of hospital-acquired pneumonia. A nursing student is studying the respiratory system in preparation for caring for a pneumonia patient. Which structure does the student correctly identify as the primary site of gas exchange in the lungs? A. Bronchioles, B. Trachea, C. Alveoli, D. Bronchi. The correct answer is C. Alveoli. The alveoli are tiny air sacs at the end of the respiratory tract, where oxygen and carbon dioxide are exchanged between the lungs and the bloodstream. Their thin walls and rich capillary supply make them the ideal site for this exchange, which is why pneumonia is so dangerous when the alveoli become filled with fluid and exudate, directly disrupting this process. A nurse educator is explaining the role of surfactant in respiratory function. Which statement best describes how surfactant relates to pneumonia pathophysiology? A. Surfactant production increases during pneumonia to compensate for inflammation. B. Surfactant has no significant role in pneumonia pathophysiology. C. Surfactant is destroyed by pathogens and inflammation in pneumonia, increasing the risk of alveolar collapse. D. Surfactant acts as an antibiotic to destroy bacteria in the alveoli. The correct answer is C. Surfactant is destroyed by pathogens and inflammation in pneumonia, increasing the risk of alveolar collapse. Surfactant is a substance that reduces surface tension in the alveoli, keeping them open and preventing collapse. During pneumonia, the inflammatory process and invading pathogens damage and destroy surfactant, causing surface tension to rise. This makes the alveoli prone to collapsing, further impairing gas exchange and worsening the patient's respiratory status. A nurse is reviewing the pathophysiology of pneumonia with a new graduate. Which sequence best describes the progression of bacterial pneumonia in the lungs? A. Bronchospasm to mucus plugging to lung collapse to respiratory failure. B. Pathogen inhalation to alveolar invasion to inflammatory response to exudate formation to consolidation. C. Pleural irritation to fluid accumulation to alveolar collapse to hypoxia. D. Viral infection to surfactant destruction to atelectasis to secondary bacterial infection. The correct answer is B. Pathogen inhalation to alveolar invasion to inflammatory response to exudate formation to consolidation. This sequence accurately reflects how bacterial pneumonia develops. A pathogen is first inhaled and invades the alveoli, triggering an inflammatory response. The immune system sends white blood cells to fight the infection, producing fluid and exudate as a byproduct. This exudate accumulates in the alveoli, eventually causing consolidation, where the normally air-filled lung tissue becomes solid and airless, significantly impairing gas exchange and leading to the respiratory symptoms seen in pneumonia patients. A nursing student asks the instructor about the most common causative organism of community-acquired pneumonia. Which organism should the nurse identify? A. Pseudomonas aeruginosa. B. Streptococcus pneumoniae. C. Staphylococcus pneumoniae. Or D. Klebsiella pneumoniae. The correct answer is B. Streptococcus pneumoniae. Streptococcus pneumoniae, also known as pneumococcus, is the most common bacterial cause of community-acquired pneumonia worldwide. It typically presents with an abrupt onset of fever, chills, productive cough with rusty-colored sputum, and lobar consolidation on chest imaging. This is also the organism targeted by the pneumococcal vaccine, which is why vaccination is strongly recommended for elderly and high-risk populations. A nursing student asks the instructor about the difference between typical and atypical pneumonia. Which response by the instructor is most accurate? A. Typical pneumonia is caused exclusively by viruses, while atypical pneumonia is always bacterial. B. Atypical pneumonia presents with more severe symptoms and higher mortality than typical pneumonia. C. Typical pneumonia presents with abrupt onset, productive cough, and lobar consolidation, while atypical pneumonia has a gradual onset, dry cough, and diffuse infiltrates on imaging rather than a defined lobar pattern. D. There is no clinical difference between typical and atypical pneumonia presentations. The correct answer is C. Typical pneumonia presents with abrupt onset, productive cough, and lobar consolidation on chest imaging, while atypical pneumonia, often called walking pneumonia and caused by organisms like Mycoplasma pneumoniae or Legionella, has a more gradual onset with milder systemic symptoms, a persistent dry cough, and diffuse patchy infiltrates on imaging rather than a defined lobar pattern. A nurse is reviewing the risk factors for hospital-acquired pneumonia with a newly hired staff nurse. Which patient is at the greatest risk for developing hospital-acquired pneumonia? A. A 25-year-old admitted for an elective appendectomy with no comorbidities. B. A 70-year-old patient on mechanical ventilation in the ICU following cardiac surgery. C. A 45-year-old patient admitted for a urinary tract infection being treated with oral antibiotics. D. A 55-year-old ambulatory patient admitted for diabetes management. The correct answer is B. A 70-year-old patient on mechanical ventilation in the ICU following cardiac surgery. This patient carries multiple major risk factors simultaneously,
Advanced age brings reduced immune function, mechanical ventilation bypasses the body's natural airway defenses and provides a direct route for pathogens to enter the lungs, and major cardiac surgery creates a prolonged period of vulnerability in an environment heavily populated with resistant organisms. The combination of these factors places this patient at significantly higher risk than the others.
A nurse is assessing a patient with pneumonia and notes that when asking the patient to say the letter E, the nurse hears the sound A through the stethoscope. The nurse correctly documents this finding as A. Stridor, indicating upper airway obstruction requiring immediate intervention. B. Whispered pectoriloquy, indicating fluid in the pleural space. C. Bronchophony, indicating consolidation of lung tissue. D. Egophony, indicating underlying lung consolidation. The correct answer is D. Egophony, indicating underlying lung consolidation. Egophony is a classic sign of lung consolidation. When lung tissue is filled with fluid or exudate rather than air, sound is transmitted differently through the denser medium. This causes the spoken E sound to be heard as A through the stethoscope over the affected area. It is a reliable bedside finding that strongly suggests underlying consolidation consistent with pneumonia. A nurse is preparing to collect a sputum specimen for culture and sensitivity from a patient with pneumonia. Which instruction does the nurse correctly give to the patient? A. Collect the sputum sample after eating a meal so you produce more secretions. B. Rinse your mouth with an antiseptic mouthwash immediately before collecting the sample. C. Collect the sample first thing in the morning before eating, drinking, or brushing your teeth after taking a deep breath and coughing deeply. Or D. Swallow your secretions overnight and collect the accumulated specimen in the morning. The correct answer is C. Collect the sample first thing in the morning before eating, drinking, or brushing your teeth after taking a deep breath and coughing deeply. Morning collection is ideal because secretions accumulate in the airways overnight, yielding a higher concentration of pathogens. Collecting the sample before eating, drinking, or oral hygiene prevents contamination from oral flora and food particles that could compromise the accuracy of culture results. Instructing the patient to breathe deeply and cough forcefully ensures the sample comes from the lower respiratory tract, rather than just saliva or nasal secretions. A nurse is reviewing medication orders for a patient with pneumonia and underlying reactive airway disease who is wheezing. Which medication order does the nurse anticipate most appropriately? A. Nebulized albuterol to relieve bronchospasm and improve airflow in the setting of reactive airway disease. B. Intravenous morphine to reduce respiratory rate and decrease the sensation of dyspnea. C. Oral theophylline to provide sustained bronchodilation over a 24-hour period. Or D. Intramuscular epinephrine to achieve immediate bronchodilation in the wheezing patient. The correct answer is A. Nebulized albuterol to relieve bronchospasm and improve airflow in the setting of reactive airway disease. Albuterol is a short-acting beta-2 agonist that relaxes the smooth muscle of the airways, relieving bronchospasm and improving airflow. The nebulized route delivers the medication directly to the airways for rapid effect, making it the most appropriate and targeted intervention for a wheezing patient with reactive airway disease. It addresses the bronchospasm component of the patient's respiratory distress without the systemic risks associated with the other options listed. A nurse is educating a patient with pneumonia about the importance of completing the full antibiotic course. Which patient statement indicates correct understanding of this teaching? A. I will stop taking my antibiotics as soon as I feel better to avoid unnecessary side effects. B. I can skip doses occasionally as long as I take most of the prescribed antibiotic course. C. I should complete all of my antibiotics even if I feel completely better before finishing them. Or D, I only need to take antibiotics for 2 days since I received IV antibiotics in the hospital. The correct answer is C, I should complete all of my antibiotics even if I feel completely better before finishing them. Symptom improvement does not mean the infection has been completely eradicated. Stopping antibiotics early allows surviving bacteria, which are often the more resistant ones, to multiply and potentially cause a relapse that is harder to treat.
Completing the full course ensures the causative organism is fully eliminated and significantly reduces the risk of developing antibiotic resistance.
A nurse is caring for an elderly patient with pneumonia who is confused and unable to maintain adequate oral intake. A nasogastric tube is inserted for enteral nutrition. Which nursing action is most important to prevent aspiration during enteral feeding? A. Administering enteral feedings rapidly over 15 minutes to reduce the time the patient is at risk for aspiration. B. Positioning the patient supine with the head of bed flat during and after enteral feeding to reduce reflux. C. Elevating the head of the bed to 30 to 45 degrees during feeding and checking gastric residual volumes regularly. Or D. Withholding enteral feeding entirely until the patient is fully alert and able to swallow safely without assistance. The correct answer is C. Elevating the head of the bed to 30 to 45 degrees during feeding and checking gastric residual volumes regularly. Elevating the head of the bed uses gravity to reduce the risk of gastric contents refluxing into the esophagus and being aspirated into the airway. Checking gastric residual volumes ensures the stomach is emptying adequately and that feeding is not accumulating to a level that increases aspiration risk. These two interventions together form the cornerstone of aspiration prevention during enteral feeding in vulnerable patients. A nurse is performing an initial respiratory assessment on a patient admitted with pneumonia. Which assessment technique should the nurse perform first? A. Percuss the chest wall systematically from apex to base, comparing bilateral lung fields. B. Auscultate all lung fields anteriorly and posteriorly using the diaphragm of the stethoscope. C. Inspect the patient's overall appearance, work of breathing, skin color, and respiratory rate. Or D. Palpate the chest wall for tactile fremitus and symmetric chest expansion bilaterally. The correct answer is C. Inspect the patient's overall appearance, work of breathing, skin color, and respiratory rate. Inspection is always the first step in any physical assessment and follows the standard sequence of inspect, palpate, percuss, and auscultate. In a patient with pneumonia, initial inspection provides immediate and critical information about the severity of respiratory distress, including signs of increased work of breathing, such as use of accessory muscles, nasal flaring, cyanosis, and the overall appearance of the patient. This rapid visual assessment helps the nurse determine the urgency of the situation before proceeding with the more detailed components of the examination. A nurse is auscultating the lungs of a patient with pneumonia and hears a low-pitched, coarse rattling sound during both inspiration and expiration that clears partially with coughing. The nurse correctly documents this finding as A. Fine crackles caused by fluid-filled alveoli popping open during inspiration. B. Rhonchi caused by secretions or mucus in the large airways partially obstructing airflow. C. Stridor, indicating upper airway obstruction requiring immediate sectioning and physician notification. D. Pleural friction rub caused by inflamed pleural surfaces rubbing against each other during breathing. The correct answer is B. Rhonchi caused by secretions or mucus in the large airways partially obstructing airflow. Rhonchi are low-pitched, coarse, continuous sounds produced when air moves through large airways partially obstructed by mucus or secretions. The key distinguishing feature is that rhonchi partially clear with coughing because the forceful expulsion of air can temporarily move or dislodge the secretions. This differentiates them from crackles, which do not clear with coughing, and from pleural friction rubs, which are heard as a grating sound and are unaffected by coughing. A nurse is developing a care plan for a patient with pneumonia who has thick, tenacious secretions, an ineffective cough, and audible rhonchi bilaterally. Which nursing diagnosis most accurately reflects this patient's primary airway problem? A. Ineffective airway clearance related to retained secretions and ineffective cough as evidenced by rhonchi and inability to expectorate sputum. B. Impaired spontaneous ventilation related to respiratory muscle fatigue and inability to maintain adequate breathing. C. Decreased cardiac output related to increased cardiac workload from hypoxemia and systemic infection.
D. Decreased cardiac output related to increased cardiac workload from hypoxemia and systemic infection. The correct answer is A. Ineffective airway clearance related to retained secretions and ineffective cough as evidenced by rhonchi and inability to expectorate sputum. This nursing diagnosis directly reflects the clinical picture presented. The patient has thick secretions that cannot be effectively cleared.
A nurse is discharging a patient who was treated for community-acquired pneumonia. During discharge teaching, the patient states, "I don't need to get a flu shot because I already had pneumonia this year, so I'm immune now." Which nursing diagnosis most applies to this patient? A. Ineffective health maintenance related to inability to identify and manage health practices necessary to maintain optimal wellness. B. Deficient knowledge related to misunderstanding of pneumonia prevention strategies and the role of vaccination in reducing recurrence. C. Non-compliance related to intentional refusal to follow recommended preventative health measures after discharge. Or D. Readiness for enhanced health management related to expressed desire to improve health practices and prevent future illness. The correct answer is B. Deficient knowledge related to misunderstanding of pneumonia prevention strategies and the role of vaccination in reducing recurrence. The patient's statement reflects a clear misconception, not a refusal to comply. Having pneumonia does not confer immunity against future episodes, since pneumonia can be caused by multiple different organisms. The influenza vaccine is recommended because influenza is a major trigger for secondary bacterial pneumonia, making annual vaccination an important preventative measure. Since the behavior stems from a lack of accurate information rather than intentional noncompliance, deficient knowledge is the most appropriate nursing diagnosis. A nurse is prioritizing nursing diagnoses for a patient with pneumonia using Maslow's hierarchy of needs. Which ordering from highest to lowest priority is most appropriate? A. Deficient knowledge, activity intolerance, impaired gas exchange, risk for infection spread. B. Imbalanced nutrition, deficient knowledge, ineffective breathing pattern, activity intolerance, deficient knowledge. C. Impaired gas exchange, ineffective airway clearance, ineffective breathing pattern, activity intolerance, deficient knowledge. Or D. Activity intolerance, ineffective airway clearance, deficient knowledge, imbalanced nutrition. The correct answer is C. Impaired gas exchange, ineffective airway clearance, ineffective breathing pattern, activity intolerance, deficient knowledge. Maslow's hierarchy places physiological survival needs at the highest priority. Impaired gas exchange is the most immediately life-threatening problem, as inadequate oxygenation can cause rapid deterioration and death. Ineffective airway clearance and ineffective breathing pattern follow because they directly contribute to worsening gas exchange. Activity intolerance comes next as a functional concern, while deficient knowledge, though important for long-term recovery, is the lowest priority when immediate physiological needs remain unmet. A nurse is assessing a patient with pneumonia who develops a persistent high fever despite 7 days of appropriate antibiotic therapy, productive cough with foul-smelling sputum, and a new cavitary lesion with an air fluid level on chest X-ray. The nurse correctly identifies these findings as most consistent with A. Development of a lung abscess as a serious suppurative complication of the underlying pneumonia. B. Normal progression of bacterial pneumonia through the expected stages of resolution and healing. C. Spontaneous pneumothorax occurring as a result of alveolar rupture from severe coughing episodes. D. Pulmonary tuberculosis presenting as a new opportunistic infection in a debilitated patient. The correct answer is A. Development of a lung abscess as a serious suppurative complication of the underlying pneumonia. A lung abscess is a localized collection of pus within the lung parenchyma, resulting from tissue necrosis caused by infection. The classic triad of persistent fever despite antibiotics, foul-smelling purulent sputum, and a new cavitary lesion with an air fluid level on chest X-ray are hallmark findings of lung abscess.
The foul odor suggests anaerobic bacterial involvement, and the air fluid level within the cavity on chest X-ray is the most distinguishing radiographic feature of this serious complication.
And that is all 20 questions done. If you made it to the end of this video, I want you to know that you just put in the kind of work that actually makes a difference on exam day. So be proud of that. If this video helped you, please give it a thumbs up because it truly helps this channel reach more nursing students who need it. Subscribe if you haven't already because we have more NCLEX reviews just like this coming your way. Drop a comment below and let me know which topic you want us to tackle next, and I'll see you in the next video.